Hello and welcome from Switzerland. I'm sure that you're aware that over the past few months, health has become the top of mind topic around the globe. And in today's presentation, you will learn what wealthy individuals do to protect their health and how you can leverage this attention in your professional services business to differentiate yourself from the competition, to create stronger connections to your clients. And I will also explain to you how you can incorporate the novel approach of the medical family office into your business. My name is Robert Maciejewski, you can call me Rob to make things easier, and I'm the CEO of two healthcare companies, Swiss Insurance Partners and Swiss Health Partners. As you can see, I had to pre-record this presentation for you due to a scheduling conflict. However, I will be available live at the Q&A session to answer any of your questions together with some of my team members, so make sure to stick around. I'm sure that as a professional service provider, you have a very close relation to your clients. You know when they move to another country, you know a lot about their private life, and you might even have a very personal connection to them, and they will tell you when they fall ill or if one of their family members will fall ill. And you also know that health is a very emotional topic, with all of us having been being directly or indirectly impacted, especially and even more so in these difficult times. Now, our company, Swiss Insurance Partners, has been providing global citizens like you or your clients with international health insurance solutions for almost 25 years, helping them and their families to stay protected and to have access to the best possible treatments around the globe. For example, with global free choice of doctors and specialists, so that they can get the best treatment that's available not only in their country, but worldwide. As you can imagine, as an insurance and health advisor, we talk about health with our clients all day, every day. And what we have noticed is that there is a lot of insecurity at the moment. What will happen if I or someone from my family will be affected by the pandemic? What will happen if the healthcare system in my country is overloaded or breaks down? What if I cannot find the doctor in time? And these are all very important questions that are not only relevant to COVID, but also to the many diseases that will affect most of us in our daily life, whether that's cancer or cardiovascular issues or anything else. What has changed though in the past year or so is that people now think about health more actively. A lot of the clients we talk to no longer only react if they get sick, but they want to be prepared. They want to be ready. They want to know what to do and who to call if any health issue comes up. We've been working with health insurance companies, medical providers, doctors, private clinics, and rehabilitation centers around the globe very closely for over or close to 25 years. So we have developed a very strong network when it comes to health. And in our work, we have also realized 4 important things. Number 1, having access to the right doctor can be the difference between getting healthy quickly and having an endless odyssey from doctor to doctor where you lose valuable time that could even be life-threatening. Number 2, the health system nowadays, unfortunately, is no longer about the patient and the patient's well-being, but it has really become a financially driven system that tries to extract as much money out of the patient as possible, even if that means providing the wrong treatments or over-treating people or doing something to be able to write a bill if essentially it would be best to just wait and see how the whole situation is developing. Number 3, there is an information asymmetry between the medical doctor or the medical providers and the patients. Now, what does it mean? As a layman, as a non-professional, you typically cannot decide whether a treatment is right or wrong. So when it comes to law, when it comes to financials, we all have a certain feeling for what is right and what is not right. And we can be involved in the decision-making process. When it comes to medicine, when it comes to health and healthcare and treatments, unless you have someone in your close network that you can rely on for an opinion, you typically do not have any idea whether the suggested treatment or the suggested medicine is right, and you have to trust the doctor. And also you have no way of judging the doctor from a quality perspective. You just cannot know whether he is good or not. And number 4, having good health insurance doesn't mean that you will find the right doctor. And actually, we have found that people who have good insurance or pay out of their own pocket have sometimes worse health outcomes because they are getting the most expensive treatments and not the best treatments that would be best suited for their specific situation. Because we have a very close relation with our patients and clients, a lot of them have been coming to us over the years and asked us for the best and most trusted doctors to make introductions and to help them with getting appointments with specialists, which sometimes can take weeks or even months under normal conditions. So that's why a few years back we decided to create a service out of this approach, and we have created the Medical Family Office. The idea of the Medical Family Office is essentially to provide what a regular family office would do for a person's wealth, but to a person's health, because we believe that health is the real wealth. And I'm sure you know many examples where health was taken away from someone and there's pretty much nothing left in terms of quality of life, even if you have all the money in the world. So let me tell you a little bit about what we do at the Medical Family Office, or MFO as we call it. The MFO consists of 4 main pillars to protect the health of our clients from all angles. The first pillar, traditionally, are health insurance solutions. And as I mentioned before, we provide premium international health insurance solutions for people that have a global footprint, whether that's individuals with multiple residencies in different countries, business people and company owners, expats, and more. And the market here is really intransparent and complex, but as independent advisors who have been in the business for almost 25 years, we help our clients to find the best possible solution for their needs at the best possible price. And we also offer additional services at no cost that they would not even get when going directly through an insurance. For example, we take care of all the claims, we take care of all the pre-approval when it comes to hospitalizations and operations. We have a very streamlined application process and reimbursement process. And these are all services that we offer as a consultant free of charge. Now, the next pillar, privileged healthcare, is really the centerpiece of the Medical Family Office. We have a global network of the best doctors, clinics, medical specialists that we personally know. And that's important because it means that if you have any health issues, you do not lose valuable time trying to find the best specialist in your country or around the world, but you can be sure that a trusted doctor from our network will take care of you. And it also means that instead of waiting for weeks or sometimes months to get an appointment, you can typically get an appointment within 48 hours, since we do have that personal relationship with doctors, and then we can make sure to squeeze you in. And that's very helpful, for example, if you need to get a quick second opinion for treatment, if you want to have your case reviewed by an experienced panel of specialists, or if you're in a location just for a few days and you need an urgent appointment with a specialist. That also means that you will not be taken care of financially, since we select our doctors by the highest ethical standards, and we only work with those that put the well-being of patients and not the financial interest in the center of their attention. Now, what is very important to point out is that we do not get any financial incentives or kickbacks from any of our doctors or any of our clinics. Our business model works through a service fee that our clients pay us yearly, so we can be truly independent and we can send people only to the best specialist in the field and not driven by any financial interest on our end. For our international clients, we can also provide a lot of concierge services as well. So that goes from travel assistance, including VIP lodging, transportation, accommodation support, and even having a medical translator joining your clients to visits if they should not be able to speak the language. The next pillar is the medical records management. Our international clients often had the problem that their health records were scattered in different places, sometimes different countries or even different continents. And that is a problem if you need to undergo treatment fast and you lose time first by having to contact all of your doctors and your clinics, and maybe even having to translate medical records from Russian to English or to German, and so on. So what we do is to safely collect and store all medical information, all medical records for our clients. We translate them, we put them in the right order, and we even have them reviewed and summarized by an experienced doctor. So the next time that you need a treatment, he already knows everything about you from your medical history, a nice one-pager, any previous treatments, any risk factors, any genetic predispositions for adverse medical reactions, and more. And all the clinic or the doctor now has to do, if they need a full history, is to give us a quick call and they will have it within a very short amount of time. And this can actually be a lifesaver when time is critical. And finally, and what's probably my personal favorite topic, is our preventive medicine services. Someone once said, it's always better to prepare and to prevent than to repair and to repent. And that's especially true for your health. So many of the serious chronic diseases, including cancer, can either be prevented or at least very well treated when discovered early. But what happens if you typically have a checkup, which I know you're not doing often enough? You go to your general practitioner, he listens to your lung, he pats on your back, he hits your knee with his little hammer, and if you're lucky, he does some basic blood tests, and then that's pretty much it. And in my eyes, that's not prevention, that's negligence. We live in a time where there are so many possibilities with genetic, with metabolic testing, whether that's for the risk of developing diseases or for adverse reactions to pharmaceuticals. For example, did you know that 3 out of 10 people have a genetic mutation that causes some of the most common heart medications to either not work or to actually have adverse effects? So that means if you have a heart attack, there's a more than 1 in 4 chance, more than 25%, that you may die because you're getting the wrong medications. And do you think that's something you should know? I think it is, and there are so many more examples for cases like that, but unfortunately I don't have the time to go into more details at this point. Now, I just want to give you 3 examples from the recent weeks from our clients, and I changed all the personal information just a little bit to protect the patient's identity. So the first example is from a client who has health insurance with us, and she called us and told us that her father, who is actually living in Russia, has been diagnosed with throat cancer. And the issue with throat cancer is that if you do the wrong treatments, you may actually permanently lose your voice. And he went to 3 different clinics, actually pretty good clinics. But the problem is he got 3 different opinions. The first one, they said, okay, that's a case for operation, we can remove the tumor. The second clinic said, no, it's more a case for chemotherapy. And the third clinic says that's a case for radiotherapy. And as I said, if you're not a medical doctor, you have no basis for decision making. And so they were very confused and very insecure, if they make a mistake, if they choose the wrong treatments. And so what they did, they called us and they presented us with the case. We then took this case, got in touch with a professor who is actually specialized in these forms of tumors. And he took it himself to his tumor board. They reviewed the case and came back to us with a very detailed explanation on why this is actually a very clear case for radiotherapy, radio treatments, and cutting around may actually be very dangerous. And so we took this review, we brought it back to the clients, and they were very happy because they finally had a clear second opinion and they knew how to move forward. And they actually said, look, the level of quality that we have received and that we have seen from this doctor is so good, we would actually love to be treated by that specific doctor. Now, the problem was that was in end of last year when traveling was restricted, when there was actually the hospital where the professor works was actually not accepting any new patients until the end of spring, so until the end of March. And what we did is basically we arranged everything from getting the approval of bringing the patient from Russia to Germany. We got the hospital to accept that patient within a week's time, actually. We arranged for all the travel, all the accommodation. And the patient was able to start treatment within 1 week. Took 6 weeks of radiotherapy, plus a few leisure days to recover. And now the patient is back in Russia. Fortunately, everything worked out pretty well, and it seems like he was able to overcome this particular kind of cancer. Now, the second example that I want to give you is actually a case from earlier this year. It's a couple from Australia who moved to Spain for business reasons, and they have a few children, and one of the children, a 4-year-old son, has developed a rare case of hemophilia, which is a bleeding disorder. And the problem with hemophilia is that you can actually bleed to death internally. So every bruise, every cut, every injury is life-threatening. And also if this condition is not being treated very early, there can be severe complications later in life. So of course the parents were very nervous what to do about it. They went to the local pediatrician in Spain. received some information. He referred them to someone who's specialist or apparently specializing in this disease, put them on some medication, but still they were not feeling too well because, it's their 4-year-old son whose life is at risk and you want the best treatment. They didn't speak Spanish perfectly. The doctors didn't speak English perfectly, so there was always a bit of a communication issue. So they didn't feel right about it and they wanted to have a second opinion. So what we arranged for them is we got them in touch with one of the professors that we work with in Germany, actually in Frankfurt. They have an outstanding hemophilia center in Frankfurt, and he speaks perfect English. So he took on the case, he reviewed all the documents, he reviewed the treatment the recommendations. He got in touch with the family, they discussed the case, they discussed the options that they have long term. And what he also did, he had contacts to one of the very few hemophilia centers that exist in Spain. There are only 4 hemophilia centers in Spain, all of Spain, and he actually knew a professor who is working there. So what they did was the German professor is actually taking care of the case, is talking to the patients or the parents of the patients. And locally in Spain, they're doing the actual treatments, and the Spanish doctor and the German doctor, they're in close contact. And for the parents, it's actually a very comforting situation because they know their son is getting the best possible treatments and their son's future is actually in very, very good hands. The last case I want to present to you, the last example, is actually a case from this week, or actually end of last week. We have a client in our insurance business who has been with us for many, many years. He's a German bloke living in Dubai. And he has been calling us end of last week and telling us, I had this terrible headaches for a few weeks now. Actually, the pain goes down into my back, into my shoulder. And I went to a doctor in Dubai. They put me on steroids. Didn't really work. So I'm really not feeling well. And I need a second opinion. And I need a thorough checkup. And I need someone to look at me because something is not right. And I will be in Switzerland for 3 days, actually next week, Monday, Tuesday, Wednesday. So if possible, try to find an appointment in a specialized clinic that can have a look at my case and can check what's wrong with me. So we get in touch over the weekends and managed to get an appointment first thing Monday morning. They landed from Dubai in Zurich, visited the clinic that we sent them to, where there is a very good and very experienced doctor that has a very holistic view on patients. So he's not only looking at what's wrong and then prescribing some medicine and get the patient out of the door, but he's really looking at what's happening in their life, what's the nutrition, what are other factors that might be influencing this pain. And so he looked at our clients and said, you know what, I want you to go to a dentist right now and to get a full x-ray of your teeth, because I believe it has something to do with your teeth. And our client said, well, okay, if you say so, that sounds a bit strange, but I will do so. So he got an appointment actually the same day with a dentist, got an x-ray of his teeth. And then he called me in the evening and said, you know what, you won't believe it. They actually found that under my lower back teeth, there's a huge infection. And I know I had an infection a few years back and it was treated with antibiotics, but apparently it never went away. It got worse. I didn't feel any pain, but that infection is actually the reason why I'm having a headache, why I'm having the pain is going down my neck into my back. And so now we know what the case is, we know what the root cause is. So actually in that case, the root cause or the tooth was removed, or several teeth were removed. Infection is being treated locally. Patient is already much, much better and is already, by the time you're watching this, back in Dubai and had received the right treatments. And there are many more examples like this, and I'm sure that you can see the value of having access to this network of global specialists and doctors. So you might be wondering now how much the service would actually cost, and actually I think you will be surprised. It is our goal to help as many people as possible. So we wanted to price this lower than even your typical international health insurance. So as I told you, we do not take any money from any doctors or clinics. So instead, our business model is that we charge our clients a flat yearly fee that starts at around $250 per month. And for this amount, which really is a fraction of what clients typically pay for their health insurance, you get access to the best possible medical network that you can imagine. And you can make sure that you not only get healthy, but also stay healthy. And if you think about how much people spend for food and for wine and for watches and cars, none of which will help you when you're getting sick, we believe that's truly an amazing value. So in essence, having a good international health insurance, giving you access to treatments around the globe, plus having access to a medical family office with the global network, with the best possible doctors, is the perfect combination to protect your health. And recently we've seen a ton of clients coming in who truly care about their health and their family's health, and they want to protect them in the best possible way. So that's why they choose our solutions. Now, in the beginning, I told you that there is a great opportunity for you as well in this. And there are actually two things. First of all, health is one of the most emotional topics. And I'm sure you have a very close relationship with your clients. And I imagine that a client comes to you telling you about specific medical conditions at times. And if you will be the one who will be able to help them or help their family member, there's simply no better tool to make sure a client will stay with you for life. If you help someone to get better or to save their family or save someone's life, they will never in their life forget about this, and that's absolutely huge. Now, the second thing is we get our clients through two main channels. The first one is personal recommendations and our website, but the majority actually comes through professional services providers like yourself. And the reason is that we typically have a very similar clientele. It's affluent people, they typically have a global footprint, so it's a perfect match, and we don't compete in terms of services, but we match pretty well. So if you can recommend us any clients, then we are more than happy to share our revenue with you, whether that's from insurance or from health services. And more importantly, think about how much you can stand out from your competition if you can not only provide financial or CBI or whatever services, but you can also act as the protector of your client's health. And there's no work for you because we take care of everything, but no, almost nobody does this in your field, I'm sure. And if you want to integrate these services into your offering and make a great package that goes beyond financials or investment advice or relocation advice, then we would be more than happy to help you with that. As I just said, I believe it's a great opportunity to differentiate yourself from the competition, to create stronger connections with your clients, and to become the person that clients will be forever grateful for, because you have supported them with their health in a critical time. So if you would like to learn more, we would love to have a personal conversation with you. You can reach out anytime to me and my team at zurich@sip.ch or via this phone number. We also have team members that speak Russian, by the way. And please make sure to visit sip.ch/investpro for more information and a really special offer that will only be available for participants of this workshop and only in the next 72 hours. So make sure to visit our website and don't miss out. So that's it from my end. I hope I wasn't talking so fast. I always get excited talking about this topic. It's just absolutely amazing to be able to help so many people from so many different countries around the globe. So all the best from me and the whole team at Swiss Insurance Partners and Swiss Health Partners. And most importantly, stay healthy.